Good afternoon, everybody. I'm delighted to welcome you back to the Fulfilling Lives conference for those of you that are joining us online. My name's Lindsay. I'm one of the CFE team, and I'm delighted to be able to introduce our second workshop this afternoon, which is entitled Achieving Systems Change to End Homelessness, What Works? We're really pleased that we've got 4 colleagues joining us this afternoon to facilitate this workshop. We've got Lydia Teixeira, the Chief Executive of the Centre for Homelessness Impact. We've also got Greg Hurst, who's Head of Communications and Public Affairs with CHI, and also Nick Barthodi, who is the Evidence and Data Impact Specialist. The team from CHI are also joined by Ursula Martinovska from Opportunity Nottingham. So as with this morning's workshop, please feel free to use the chat to introduce yourself to other delegates that are joining us online. Use the Q&A function to pose questions. The team will be pausing at about 3 kind of points throughout the workshop to be able to respond to any questions that you might have or any thoughts and reflections. So, as I say, strongly encourage you to put your questions in those functions. But without further ado, I shall hand over to Lydia.
Thank you so much, Lindsay. I'm thrilled to be with you all today, even if not in person, and welcome. I hope you're having a great conference so far. And as Lindsay said, the theme of this session is Achieving System Change to End Homelessness, What Works? It's very much about the Fulfilling Lives team asking us to help explore the legacy of the program, as well as the wider evidence of what works to address multiple disadvantages, and consider the types of investment needed in the future, building on the legacy of this groundbreaking program. So over the next hour, we will hear from someone with deep experiences of the program, as well as from our team. It's a truism to say that a lot has happened since the Fulfilling Lives program started, but it's true. A lot has happened, and a lot of what has happened has been deeply sad and worrying, but we should also be ridiculously proud of what's been achieved. So we must ensure that what comes next very much builds on what we've learned for the Fulfilling Lives program, and we don't let that knowledge go to waste. So that's a very good reason to be here. Welcome. And now it is my great pleasure to introduce my colleague Greg Hurst, who will introduce the next part of our session.
Thank you very much, Lydia. So our first speaker is going to be Ursula Martinovska, and Ursula has volunteered with Fulfilling Lives in Nottingham from the beginning. Welcome to you, Ursula.
Hi, Greg.
Thank you very much. Now, I'd like you to tell us about your work with Fulfilling Lives, particularly your work in research and evaluation. But first, you have personal experience of homelessness, and I wondered if you'd share with us how you came to. I think you first went to a large hostel when you felt in arrears with your rent. Is that right?
Yes. Yes, I was put in an accommodation that was shared accommodation, very little support, a lot of people in there with drug and alcohol problems, and I didn't feel safe, so I asked if I could be moved, and luckily for me I was able to be moved to a women's only hostel, which was very small numbers and very intense support. For me personally, the support was more like having activities and things like that, and then they helped me to eventually get my own accommodation and I went into work. But I only had sort of one issue, which was homelessness, and it was still daunting.
It's fascinating because the evaluation of Fulfilling Lives, called More Than a Roof, it says that hostel provision, sometimes when it's large hostel provision, can be inappropriate setting for many people. And that was your experience in the first hostel, wasn't it? You really had a poor experience.
Yeah, I mean, well, yeah, there was someone in there who I knew and I didn't want to be around, and yeah.
And you were telling me, interestingly, when you moved to the second hostel, which as you've described was more bespoke, I think the phrase you used was it made you feel human again.
Yeah, it was more like a home than a temporary sort of thing.
And it was the activities as much as anything, as well as the support that you found.
I believe so, yeah. It made you feel part of the community, part of things to do and occupy your time.
And tell us what sort of activities you enjoyed.
Oh, loads, swimming, Pilates, yoga. We used to have something called Stitch and Bitch, sort of painting and yeah, loads of stuff.
I think you would eat together, go shopping and cooking.
Oh yes, yeah, we did. Yeah, once a week. We used to work on the allotments. Yeah.
Yep. And I think your experience of homelessness lasted about 18 months, but then you got a council flat, and as you've told us, you've got a job. So yours is a success story, as
Yeah.
case. Yeah. And it's interesting, like many people who experience homelessness tell us they want to support people who are in that position now. Was that your motivation for volunteering in the Nottingham Fulfilling Lives project?
I guess so, yeah, yeah. I was already a volunteer with an advocacy group, and I was approached by them to create something called Fulfilling Lives, and I thought, yeah, I'll have to go.
Yep. And so clearly this has been a long running program. You'll have done a lot of things with the program. Tell us one or two things that stand out for you as you found really satisfying, but also you felt were worthwhile.
Well, I've done excuse me, peer research with together with Nottingham Trent University, where we've interviewed beneficiaries and sort of found out what's worked for them, really.
Yeah. And do you think that the fact that you have your own experience of homelessness helped these residents open up to you in the research you were asking?
Definitely. That was the whole sort of idea, really. Yeah, because we've been there, maybe not in the same circumstance, but similar, because we've been there, where, I don't know, they seem to open up more anyway.
Yes. Incidentally, everyone, if you have any questions for Ursula, please pop them in the Q&A, because we want this to be interactive. But you were telling me, Ursula, that one of the pieces of research you did for Nottingham Trent University, this was with residents in a Housing First scheme, and you were asking them what they. So tell us what you did and what they told you, these residents.
Well, I think the key first was actually getting a house, getting housing, and not just any old house, appropriate housing. And then the best outcomes were where they had a good support worker, not who just looked at the practical stuff or the needs, but also their interests and strengths, building good relationships, just things like taking them to appointments, checking in on the phone, and people I interviewed just seemed to be so like they were moving forward.
Yes.
And they were really grateful to have support.
Yes. Incidentally, there's a question that's come in on the Q&A from Tom, who asks you, so clearly you've had 8 years of volunteering for this program, and Tom asks you, are you optimistic about the future?
Yes, definitely.
Yeah, I suppose he means not just your own future, but for these people who've been supported by Fulfilling Lives, some of them with multiple experiences of disadvantage. Do you think there are reasons to be optimistic?
So there are multiple disadvantages now being talked about more. It's in the government's Changing Futures programme. It was talked about through Dame Carol Black. It's being talked about in Nottingham, anyway, in the 10-year mental health strategy that's come from the government. So yeah, but I think it's going to be experts being involved in future conversations, etc. That's going to help to move it forward as well, to keep it going.
Yes. There's another question has come in, Ursula, from Bobby Lowen, I hope I've pronounced that correctly, who says, great to see you, Ursula. Can you say anything about what kind of difference it makes to people who've joined the programme? He says people have had their own experience within the team and the workforce. I need my glasses for this. Yes, sorry, he said, the question is, what kind of difference it makes to people who've joined the programme to see other people who've had their own experiences within the team?
I'm not sure I understand that, but I've seen beneficiaries' confidence grow immensely and their self-esteem.
That must be very rewarding for you.
Oh gosh, yeah.
You told me about one man who'd been moved multiple times, and you thought, in your view, he'd been put in the wrong environment.
Yeah, we've been put in shared accommodation, like private landlords, hostels, and he's now got a his own flat, but he's got support there 24 hours apparently, and he looks so much happier, yeah, more stable.
Some of your work has been done with the group Expert Citizens.
Yeah.
And just tell us, for people who don't know about Expert Citizens, you're a group of people with lived experience of homelessness and disadvantage. Tell us about some of the things that you've done.
Well, we meet regularly. We've had we've been asked questions about what do we think about this and this. We did I can't think what it's called now. Sorry.
While you're thinking, Ursula, one of the things I think Expert Citizens do is they evaluate services, don't they?
That's
they go in and see if they meet 4 standards of things like, well, you'll tell us what the standards are. Sort of respect, listening, that sort of thing.
Yeah, that's what I was trying to think. This like charter that we made.
That's right.
The beneficiaries also produce something kind of like something so that they don't have to keep telling their story, and it talks about their strengths, not just their negative stuff.
It's the real issue, isn't it, being made to tell your story again and again, especially if there's a trauma involved. It can be it can repeat the upset, can't it?
But like anything, it needs proper funding. If it's going to go on into the future, it needs proper funding.
Do you think this work has made a difference, talking to services about how they can listen to the insights of people with personal experience of disadvantage and homelessness?
Yeah, but it's still got a long way to go, I think.
It does, doesn't it? And so as the Fulfilling Lives programme comes to an end, will you carry on volunteering in a different role, perhaps?
Hopefully with Changing Futures and the National Experts Group.
Because the National Experts Group keeps going. I think it's a different status now, isn't it? And they've really advanced this work of the voice of lived experience. Yeah. Well, look, Ursula, I'm really grateful for your contribution and your insights, and I do pay tribute to you for your volunteering with the scheme. So thank you very much, and very nice to hear from you today.
Thanks, Greg.
For the next session, the next part of our session, we're going to hear about the evidence of interventions to support people experiencing multiple disadvantage. And I'm delighted to hand over to my colleague, Nick Batholdi, who works with us at the Centre for Homelessness Impact. Over to you, Nick.
Thank you, Greg, and thank you all for attending today. It was really interesting, Ursula, to hear about the types of services that you felt were quite helpful for providing a sense of community for you. Links in a little bit to what I'm going to be discussing today. And what I'm here to discuss is what the evidence says about what works for people experiencing homelessness, as well as another support need. And I'll focus specifically on the evidence for services designed to address substance use and mental health, including the more commonly implemented services, as well as interventions that are well evidenced, but haven't been piloted in the UK. And firstly, and this is an issue that comes up time and time again, and the Fulfilling Lives evaluation speaks to well, is that we know the causes of homelessness are systematic and interconnected. And this means that programs which aim to improve outcomes for people experiencing homelessness need to take these various causes into account when designing interventions. So for example, we need to work with people being discharged from prisons and are assessed as at risk of homelessness to ensure they have a housing solution when they leave and have additional necessary support to prevent homelessness, such as access to mental health and substance use services. So we require a suite of connected services to address these interconnected issues. And people experiencing street homelessness face a disproportionately high risk of mental health and substance use issues. And these are key barriers when trying to find and maintain stable housing. Chain data from London reports that around 50% have either mental health issues or drug or alcohol support needs. And 30% of this cohort have 2 or more of those support needs. And in conjunction with experiences of street homelessness, this can lead to extremely high burden for people and can cause cyclical homelessness. Beyond just street homelessness, aggregating for those experiencing all types of homelessness. So that includes things like people living in temporary accommodation or sofa surfing. 26% of people who are owed a homelessness duty report a mental health need. And this is still far higher than for the general population and can partly be explained by the burdens placed on people as a result of homelessness. Alcohol and drug dependencies are far lower for this group than when accounting only for those who are sleeping on the street, with 7% having a drug dependency and 5% having an alcohol dependency in England. And I don't need to tell everyone here that there's significant overlap between mental health and substance use issues. And we can move on to the 2 following slides. And the next slide, please. So we know that support for substance use and support for mental health needs can be siloed and act as a barrier to access other types of support. So for example, some mental health services require substance use issues to be addressed before people can receive mental health support and vice versa. And additionally, housing support can require abstinence, which can act as a definitive barrier when to escaping homelessness for many who are dependent on substances. And as we'll come to later, the evidence strongly suggests that a housing-led approach is key to improving people's outcomes, particularly for those with multiple disadvantage. Now, in terms of speaking about the evidence, there are many types of interventions we could have covered today that address the many levers that we need to pull to address systemic issues. We've chosen to focus on what the evidence suggests is effective regarding mental health and substance use service provision. It's key to acknowledge that we need programs which address all of these areas holistically to effectively prevent and address homelessness. So regarding substance use interventions, some of the best strategies are those that provide a stable environment with a focus on safety and creating a non-judgmental environment. We could move on to the next slide, please. Harm reduction strategies are those whose primary objective is the reduction of harm to an individual. And these are sometimes seen in opposition to abstinence-based approaches, in which the primary objective is to not use substances. Now, we'll look at the effectiveness of harm reduction interventions first. So many of these interventions are well evidenced for effectiveness, especially concerning opioid use in the US. One example of these interventions is a supervised consumption facility. Now, these are facilities which are legally sanctioned spaces in which people can take pre-obtained drugs in a controlled setting under the supervision of trained staff using sterile injecting equipment. Really key here is that people also have access to other services, including physical and mental health services. Reviews have found that these facilities reduce cases of overdose and high-risk injecting, among other substance-related outcomes relating to harm. Other harm reduction interventions that have been evidenced for effectiveness include take-home naloxone, which when administered at the right time can help prevent deaths from opioid overdose. There's also evidence for effectiveness is opioid substitution therapy, which replaces high-risk opiates with other less harmful substances. And while these harm reduction strategies are effective, we also know that housing-led interventions which require abstinence can be effective. So therapeutic communities are an example of this type of intervention, which include a structured program in a residential setting. These interventions work for those who feel ready to give up substances. So both abstinence-based and harm reduction approaches have a role to play in improving outcomes for people who do use substances. Current evidence indicates that housing does not have a positive or negative effect on substance use, but it does provide critical stability and can decrease the length of time someone spends as homeless. And finally, for substance use outcomes, there's mixed evidence of the effectiveness of case management interventions. There's some evidence of the effectiveness of intentional peer support, in which peer support is fostered through professional organizations in improving outcomes. So we know quite a lot about the effectiveness of substance use interventions in improving outcomes. And the obstacles to implementing those interventions are mostly political barriers, which is why we see very few examples of some of these interventions being implemented. And as always, we'll push for these to be trialed and tested in different contexts. For mental health, however, we see many interventions implemented that either have little evidence of effectiveness or have been tested and show that they don't produce statistically significant impacts to mental health outcomes. And there are two key implications here. The first is that we know what we are doing now is not effective at improving mental health outcomes for people experiencing homelessness. And if that's the objective, we need to be trialing other interventions to see what is effective at doing this. But perhaps the more critical implication is that these interventions are ineffective for improving mental health outcomes while people are not housed. And this strongly supports the notion that improving people's housing situation is key to enabling people to improve outcomes in other areas of their lives, such as mental health. And there's excellent evidence of the effectiveness for some psychosocial interventions, such as behavioral therapies, and improving outcomes for the general population. However, the evidence is mixed regarding their effectiveness for people experiencing homelessness. And the problems and stresses caused by homelessness here restrict the utility of these types of interventions. Therefore, housing issues must be solved first to enable improvements in mental health from tested interventions, such as behavioral therapies. Two approaches that are frequently implemented across organizations are trauma-informed care and psychologically informed environments. And these approaches are difficult to test as they're intentionally vaguely defined to allow practitioners to tailor them to their own practice. This does mean, however, that we don't know if they're effective at improving outcomes for people because it's particularly hard to test these this type of intervention. To know this, we'd first need to map out what practice looks like across the sector and define different types of these type of intervention so that we can test them. There's also no conclusive evidence that psychosocial interventions produce positive effects for mental health for people experiencing homelessness. In this case, psychosocial interventions can mean any intervention which is designed primarily as psychological or social and not including pharmacological elements. And finally, quite surprisingly to a lot of people, existing evidence suggests that no model of case management is effective at improving outcomes related to mental health for people experiencing homelessness. And this is surprising as some models are set up specifically to address these types of outcomes. So CHI has commissioned a review into these interventions. We've already received a first draft with findings that really support this notion that even though case management can be really supportive for housing-related outcomes, it has no impact on mental health outcomes. Regardless of any of the services that we've spoken about today, we know that these services aren't sufficient to end homelessness. While they're essential, in many instances, these programs are reactive to the issue rather than proactively preventing instances of homelessness. And we need to ensure that they're implemented in concert with interventions that tackle root causes of homelessness, such as poverty, availability of affordable housing, high rents, and welfare. So a key takeaway here is that even though there's evidence that we can learn from and can influence policy and practice, robust evidence of effectiveness for homelessness interventions is still very rare, especially in a UK context. But on the bright side, the evidence base is growing rapidly. CHI built a tool that systematically maps out all the robust evidence of homelessness interventions. One lesson we learned from the map is that half of all robust evidence around homelessness interventions was published after 2015. And this is really promising, and we hope to see this trend continue. UK-based evidence is seeing a similar upwards trend. However, we're still producing a lot of reviews of existing evidence, mostly of US-based evidence, and we're still producing relatively few robust evaluations. And randomized control trials, which are kind of the gold standard for evidence that we're seeking, are still very rare in the UK. And we need to see more of these produced to fully understand how well interventions work in our own context. And thank you for listening.
Well, thank you very much, Nick. We'll just wait for his slides to disappear from there. If you do have questions for Nick, pop them in the Q&A. Nick, there's a fascinating message there, isn't there? Because we do know quite a lot, but there are such gaps in the evidence. And one example sort of comes to mind from what you were saying about psychosocial interventions being rare in homelessness. And you can really see how somebody experiencing trauma and leading a disrupted life during the experience of homelessness just may not be in a position to benefit from some psychosocial interventions like counselling, which has to be regular. It's not a magic wand, is it? It's a process.
Yeah. Yeah, I think in that instance, you know, if you think about the way that things like behavioral therapies are designed to try and change the way that people are thinking about certain aspects of life. I mean, when you're in a situation in which the stresses are extremely high and the risks are extremely high, it's very difficult to change the way you look at things. And you know, a lot of the time for a more general population, it can be effective when trying to look at things in a brighter light, and that's still possible. But when the stresses are so high and the risk is so real, it can be very difficult to do that.
So, as you said, there is quite a body of evidence that's been undertaken in the United States, including a much greater tradition of quantitative analysis and evaluations. So why can't we just look at what's happened in the US and say, well, that's bound to work here?
Yeah, it's a great question. We get that question a lot. And the answer is, in some instances, we definitely can. And in some instances, we have to interpret with caution. And that's because with the more robust types of evidence that we're collecting, what we're looking at are some people who receive a treatment, so that can be something like a behavioral therapy, compared to someone who doesn't receive the treatment. And the reason that can sometimes be difficult to interpret findings from the US and take them directly into a UK context is that the standard provision, without what we're providing, so say someone's receiving behavioral therapy, what is the alternative there? So what would someone have received if they hadn't received that treatment? And that can vary, right? So a lot of things will be consistent with the UK and the US, but a lot of, for example, welfare-based interventions will depend on the welfare system of the country, and that will be very different in the US compared to the UK. So just being cautious in interpreting results by seeing what's generalizable, what are the similarities, and then you can see whether or not you can directly apply something, or the evidence needs to have some caveats when interpreting those findings.
And we heard from Ursula earlier about some of the work she's done in conducting research, conducting interviews with people, for example, who are residents in a Housing First scheme. When you're designing research programs or reports at the Centre for Homelessness Impact. What's the role of people with personal experience of homelessness, and at what stage would you get someone with that background involved?
Yeah, pretty much as soon as we've decided. So they'll help decide. We bring not just people with experiences of homelessness, but people across the sector. Obviously, the people experiencing homelessness are critical to this, but the very first instance of involving people in this in the process is to figure out whether we're asking the right questions, right? So once we've decided we want to see if a certain intervention is effective or not, it's trying to make sure we're asking exactly the right questions to make sure that the findings of the evaluation will be useful at the end of it. And that will be relevant for policymakers, for people who are conducting the interventions, and the people that are receiving the intervention, of course.
A couple of questions coming in. Nick. One's from Dion Peters, who says, do you have any data on women's homelessness?
We do have data on women's homelessness. We also have a paper that we published, I think it was last year, on interventions related to women's homelessness. So I encourage you to go and have a look at that. A lot of really good detail in there.
I think it's the case, though, that with patterns of women's homelessness can make this a more difficult phenomena to measure, to quantify, because women, I think, are more likely to experience homelessness in hidden forms like surfing, being under a roof, but effectively being homelessness. And this is really hard to capture in official data, isn't that right? Yeah,
definitely. I mean, a lot of the times it will be the case that women are trying to make themselves at least visible possible, right? So especially when the street counts are conducted around street homelessness, those numbers won't be picked up. So it does carry its own challenges in terms of collecting data around women in street homelessness.
Saskia Smith is also interested in the paper on women's homelessness. Nick, do you want to just give a couple of sentences on what that paper sought to do?
I wasn't actually involved in the writing of that paper, but I can definitely link.
I'll tell you what we'll do, Saskia. This was looking at what we currently know about particularly women who experience domestic abuse and homelessness, and looked at the current evidence base. And we also had interviews with 14 women who had themselves experienced homelessness after experiences of domestic abuse. What I'll do in the next session is I'll just get a link and pop it in the chat there. I do recommend this to you. Another couple of questions, Nick. There's one from Tom here. It's a tough question, this. Would an opioid epidemic in the UK, like that currently being seen in America, would that significantly increase the level of homelessness and compromise progress we've made?
It's a good question. I think in terms of it significantly increasing, it's hard to know exactly because we can't quantify the impact that substance use has on homelessness. But we know that it is a cause, so it's very likely to, yeah. In terms of the progress, I think a lot of that depends on the types of interventions that we're rolling out. I think there's a lot of really promising interventions that that aren't being even trialed in the UK. And I think that obviously with substance use interventions, it's quite political around what is and isn't implemented. But in terms of the homelessness numbers increasing, I'd say there's pretty much no doubt that would happen, but the scale is pretty impossible to know, really.
Yeah. Question here from Thomas, who asks, is there data on the COVID-19 interventions on rough sleeping, and what will the likely effect of these ending be?
That's a big question. In terms of specific interventions, I think because everyone in was across the country, you can kind of just look at the general countrywide data and see the impact that it had. And there's no doubt that it was a massive success. In terms of the effect of ending it, that really depends on the way that it's ended and what the interventions are that are put in place to replace those interventions. There's a lot of very complex things to unpack there, especially around people with no recourse to public funds who were taken in during everyone in, and what the plan is to help people who can't be caught by the welfare state in that sense. But yeah, that's a great question, a very, very chunky one for this session.
Nick, they're coming in thick and fast now. We've just got time for one more. There's a question here from Dion about critical time interventions. and she says critical time intervention is used in the United States. Is that something that could be looked at here?
Yeah, I think I'm correct in saying that it has been implemented in some instances in the UK. The critical time intervention, so for those who aren't aware, is a type of case management intervention in which it helps people transition from certain circumstances into others. So for example, it can be used when people are transitioning, being discharged from prison, to make sure that there's someone helping them, for example, with their housing situation 3 months before they're discharged, and then just after their discharge, and carrying on that support, as well as providing kind of mental health support, wraparound stuff. The evidence is really strong for critical time intervention. I'm a big proponent for it being trialed more robustly in the UK before it's kind of brought out across the country. But I think it's a really promising intervention that there's a lot of talk about at the moment.
Great, Nick. There's a saying in show business: always leave your audience wanting more, and you've certainly done that. There's still questions that are live in the chat and the Q&A. We do have to move on to our next segment, but Nick, I'd encourage you to just have a look at the chat, and if you can keep the conversation going, I'm sure people would be grateful. But that was a fascinating insight there. Thank you so much, Nick. We're now in the next segment of our session. We're going to hear from Legia Teixeira, who's Chief Executive of the Centre for Homelessness Impact, and Legia is going to talk about looking ahead and what the future may hold. And while Legia's speaking, do pop any questions in the chat, and we'll take them towards the end. There'll still be time for more. Over to you, Legia.
That's right. Thank you so much, Greg. I suppose we want to spend the last section of the session reflecting on the lessons from fulfilling lives. And if there's one lesson that I think we should take from the experience of the last few years, is this: that ending homelessness isn't rocket science. It's actually a lot harder. We know the laws that govern quite a lot of how the solar system works in particular. No similar laws actually govern things like homelessness. Social issues are actually a lot harder to solve. Yes, getting a rocket to the moon is complicated, but solving homelessness is complex, not dissimilar from other social issues like obesity. We know that things like gastric bans work. They work at individual level, but they don't solve obesity at population level. So the same is the case in homelessness. There are no silver bullets. No single interventions will ever end homelessness or even street homelessness. To end obesity at population level, we know that we need to tackle the problem in different dimensions. So this is an example of the systems map that the Foresight program developed some years ago. We have a similar one that we co-created with the sector for homelessness. You need to look at the issue from multiple lenses, whether it's environmental or social, or in the case of obesity, obviously, food, physical, health, all sorts of lenses. So the same is the case for homelessness. And it's really important that we bear that in mind, how difficult it is to actually effectively tackle something of this nature. When it comes to the situation we're at now, it's actually not a negative one, I guess. We should feel very proud of what we've been able to achieve throughout the Fulfilling Lives program, and more recently, of course, what we lived through the pandemic. I know the evaluation doesn't capture that part by and large. Lots of people were housed already in longer term accommodation now, unlike many other developed countries. So that's something that we should be proud of, and in many respects, homelessness is certainly the good news story of the pandemic. The risk, of course, now, I don't need to tell you, is that this great progress will actually be lost. Despite ongoing commitment, we know that the workforce is exhausted. There's lots of people leaving the sector as well. In fact, we're very worried about that. We also know that many people already report feeling at risk of becoming homeless as well. This is from an Ipsos Mori survey that we conducted in the winter. So our hypothesis is that now the situation might be even worse. So things to really be wary of. But there are opportunities, many in fact, and certainly at the Centre we're always focused on zooming in on those. And one of them that keeps us very much feeling optimistic is that the commitment to ending rough sleeping in England and homelessness in Scotland, Wales, Northern Ireland remains very strong. So we must do everything we can to ensure that continues to be the case, because ultimately we know that policy levers make the most difference when it comes to addressing homelessness at systems level. Another important issue, and very much echoed in the findings of the Fulfilling Lives program, is the fact that homelessness needs to be seen very much as a healthcare issue, not as a separate non-health problem to deal with. And often we see health issues being treated entirely as a medical in the medical paradigm, without taking into account the problems that people might be facing. So we know that it's futile to treat homeless patients and then send them back to the social conditions that actually made them sick in the first place. So how can we ensure that the health world is more involved in tackling and ending homelessness and street homelessness? And precisely because of this, I guess, the publication of the first ever guideline on homelessness earlier in the year is a key milestone in my view. It gives us the opportunity to really take guidance from NICE, and obviously they were co-created with the field, to make sure that we are taking steps and implementing ways of working and embedding the types of not just services, what's good practice, but also the right behaviors and right culture in the process as well. So if you haven't come across the guidelines, please do. It's one of those things that you think probably existed before, they haven't. So a great thing that we were able to achieve despite the pandemic, and now we have the opportunity to go out into the world and actually implement them in all our services now. And another thing that I wanted to highlight is, of course, the fact that the pandemic highlighted the importance of collaboration across health and homelessness, but it also highlighted some of the gaps. We still have a huge amount of work to do. There's some examples of really interesting practice, like a new scheme at St. Thomas's, specifically for people experiencing multiple needs, whether they're substance misuse or street homelessness. We need to make sure that the capacity of those schemes is able to address need. They need to be available at pan-regional level as well. So great foundation to now build on. But what we also know from our work is that collaboration between sectors, only for those with long histories of homelessness or multiple disadvantage, simply isn't enough. We know that it's precisely because we failed people for many years that they end up in those situations. So what can we do to ensure that that collaboration is embedded much earlier on in the journey? And certainly we feel that the complexity and the damage that homelessness creates without that foundation of housing that doesn't enable you to tackle other issues, whether it's substance misuse, whether it's mental health, and whether it's recovering from a history of violence or criminal history. We need to ensure that we get better at understanding what works, because the reality is a lot of money goes into the system each year, certainly at least £2 billion. And a lot of that money goes into crisis interventions as opposed to addressing the root causes and focusing on prevention. We also need, of course, to understand what's most effective. We have the responsibility, leaders across the system, to want to know. And one of the things that Fulfilling Lives really highlights, and what Nick talked about does as well from the international evidence, is that we still don't know how best to target services and programs to people from different backgrounds, different needs, characteristics, whether it's LGBTQT, whether it's women fleeing violence, whether it's young mothers, whether it's low-income families with or without children. We don't know what works for these different groups, and we suspect that they may need different types of interventions to the one size fits all approach that we are able to offer currently by and large. The other thing that we know is a gap is the fact that, as already referred to today, and certainly in the evaluations from Fulfilling Lives, it seems to be the case that the combination of approaches works best, but we don't know what exact combination of approaches work best for which groups. And that's really key to understanding value for money when it comes to doing this work. It's really vital to understand what combination of services, of offers, works for specific types of groups. That's how we can make very limited resources go further. To get from good to even better, that's where we need to go next. And finally, really using data for action and impact. This is something that, of course, all of you will be doing a lot of already. There's so much activity, so much desire we find to get even better at collecting outcomes data and understanding how to assess impact. Now, this is work that we need to continue to build on. We've done some great work in the last few years, and now we need to go from good to better, to really focus even more on outcomes rather than activities. And this is the type of work that you hope that foundations can continue to invest in. So if we do all those things, we have the opportunity to really build a system of practice and policy and learning that asks and answers ever more specific questions, as well as going back to the deeper causes. It's the zooming in and out. It's really critical to take our work to the next level. Now, at the Center of Homelessness Impact, our mission is very much to act as a catalyst for evidence-led change, to support champions at all levels of your organizations and the system to end homelessness, to help you make, even better use of data and evidence, put data and evidence to work, so to speak, to really improve the results that you deliver for the people that we are here to help. Obviously, we believe that it's possible to end homelessness for good, but it won't happen until we are able to really target our efforts even more meticulously, take that systems view of the issue, and very importantly, actually, embrace a learning mindset. That's really critical, we find, to really improving the impact of our work. We know perfectly well it won't be easy. All the evidence suggests that. But we also know that history shows that bold goals seem impossible until they aren't. Thank you.
Well, thank you so much, Lidja. And we do have now some time for questions for Lidja, so do pop any questions in the Q&A box. Lidja, I just want to take up some discussion that's in the chat at the moment about women and homelessness, which we referred to earlier. There's a couple of reports been shared by Fulfilling Lives programs that did evaluations in this in Newcastle and Gateshead and in Islington and Camden. Are there interventions on support for women experiencing homelessness or at risk of homelessness that you would like to see tested?
Well, I think it depends. There's certainly, like Nick referred to, there's some interesting work being done with women fleeing domestic violence in particular, and ensuring that women are able to remain in their homes, for instance, as opposed to fleeing and having to use a refuge, where lots of other traumatized women will be often with their children. So that's certainly one to look out for, something that was introduced in Scotland in particular recently, and we'd like to see more of those types of schemes that ensure that people can remain in their own environment. I think it's about choice. You know, some women are perfectly happy being in schemes that are mixed, while others would really like to have the types of environments where they can enjoy the company of other women, while others, you know, just want to be in a normal community. So it's very much, I think, about choice and ensuring that we're responding to that.
Thank you. So we've talked a lot in this session, Lydia, about evidence, about the what we do know from the evidence base, but the gaps that exist in the evidence base. Do you see your role as just to generate and collate this evidence? Is that enough? It's just to create a great big pile of shiny evidence in university archives and on our website? Is that going to do it?
Well, that's why we're not a research center, we're a WhatWorks center, and WhatWorks centers not only improve the quality of the evidence base and fill the gaps, and not just directly, but also indirectly by working with universities, research councils, but we also work with leaders, practitioners at local level, policymakers at national level across the UK to help them implement that evidence in practice. Most importantly, we listen to what they need, you know, and that's what helps shape very much our research program. And finally, we're trying to mobilize this wonderful movement of people who want to do more and they want to do better. So our role as a WhatWorks Center is to support them, to give them new tools and to help shift the culture of the sector so it's even more evidence-minded.
So you're saying there is appetite for this approach. You're knocking at an open door.
Very much so, very much so. I think when you're trying to change systems, you always need to start with the people who have that appetite and really are already trying to do more, and you essentially support them so they're an inspiration to others. That's very much our approach, and certainly I've never known anyone, but practitioner or otherwise, who doesn't want to do more and better.
You talked about some of your concerns for the future. You referred to the workforce. There are these twin challenges, aren't there? People who work in the homelessness sector work so hard in the COVID period, in the pandemic, and we often find exhausted, but they too are impacted by this cost of living squeeze, aren't they? This is not glamorous work, it's often not well-paid work. What's your worry here?
I think it's interesting because I've been in the field coming up to 15 years, and I've never known a time when people feel and they look genuinely exhausted. And this is not just colleagues in government at local and national level, it's the same in the third sector. There's a genuine concern that you know, there's been crisis after crisis, and people are tired. They're really tired, and we need to make sure that we continue to nurture incredible talent and we're able to retain it, and that we take care of our people. Well-being is a huge concern, and I fear that there's burnout is a real concern.
There's a question here from Tom, different subject. Tom says, work recently done in Bristol suggests there'll be a small number of people experiencing homelessness who to some degree choose to remain on the streets. And Tom asks, does this compromise the ideal of completely ending homelessness?
I don't think so, because it very much depends on how you define ending homelessness and ending rest sleeping. And just to be clear, the number of people who you could describe decide to stay out is quite minuscule in comparison to the number of people who are flowing through the system, through the streets, and so on and so forth. And again, in my experience, just because someone in one day says that they don't want to take your offer of a particular hostel or whatever, I think it's our duty, especially people working in this particular program, Fulfilling Lives, to keep trying. And if it doesn't work, the onus is on us to keep trying and to keep experimenting with ways of ensuring that the offer is attractive enough for the individual to take it. Because the individuals I know and met who would prefer to stay on the streets, it's always because, you know, it's been so traumatic. It's been so traumatizing. And I've known people that after 30 years, they do decide to take up an offer. And it's always to do with the fact that in the end, they feel that they met someone who didn't give up on them. So we mustn't give up on people, because that's, at the end of the day, what we're here to do.
Thank you, Ligia. You talked about culture. What do you mean in a word about culture? What is the sort of change you want to see?
So, you know, the culture, it needs to be a culture of humility, I guess. You know, the scientific progress and any type of progress is always built on the basis of doing the best you can with the knowledge you have. And knowledge and data is never perfect, but knowing that often your knowledge is imperfect. And never, you know, the biggest danger is thinking that you already know everything that you need to know about what works. And that you then end up doing the same things with the same people constantly, expecting a different result. We know from implementation science as well that what takes you from okay to good is not the same that it's required to take you from good to fantastic. So we need to constantly be adapting and learning. And again, Fulfilling Lives, the knowledge that's come out, is a really good example of that. It means that we know a lot more about how to evaluate complex interventions than we did 8 years ago. So I'm sure the team involved will continue to build on that, and they wouldn't do exactly the same evaluation now if, you know, with the next iteration of Fulfilling Lives. So we must constantly be building on what's come before. And when it comes to practice, it's very much about innovation and adaptation. I think and believe, because I know them, the best practitioners are constantly innovating, and we need to pair that adaptation with more experimental methods, so that knowledge is not only used locally to improve that practice, but also can be shared much faster with other localities as well, because that's where we in homelessness, it's very much in communities, in local areas, in cities and towns.
Thank you, Ligia. We're out of time now, so it only remains for me to thank again Ursula, our guest speaker, Nick and Ligia, and now I'll hand over to Lindsay.
Thanks so much, Greg. I just wanted to reiterate your thanks. We're so grateful to yourself and Ligia and Nick, and particularly Ursula, for sharing your experience so openly and honestly with the conference. I'm always full of admiration for our experts by experience who come and share their stories. So thank you in particular to you. I've posted the link for this afternoon's plenary in the chat, and you also have that on your online programs. The whole conference is taking a short break until 2 to 3. So you've got time to go and grab a cup of tea and come back and then join us at 2 to 3 for the afternoon session. I think so. Without further ado, I'll thank you for your participation, thank our speakers again, and look forward to seeing you in this afternoon's session. Thank you.